Hello friends, today our topic is urinary catheterization. Catheterization of the urinary bladder is the insertion of the hollow tube through the urethra into the bladder for removing urine. It is an aseptic procedure for which a sterile equipment is required. Urinary catheter sizes. The French scale is used to denote the size of the catheter. Each unit is roughly equivalent to 0.33 mm in diameter. The smaller the number, the smaller the catheter. The large size catheter is used for the male because it's stiffer, thus easier to push the distance of the male urethra. Number 8 FR and 10 FR are used for children. Number 40 FR and 60 FR are used for female adults. Number 20 FR and 22 FR are usually used for male adults. Types of urinary catheters. Intermittent catheter. An intermittent catheter is used to drain the bladder for short periods. It may be inserted by a patient. Retention indwelling catheter. This type of catheter is placed in the bladder and secured there for a period of time. Suprapubic catheter. This type of catheter is inserted in the bladder through a small incision above the pubic area. It is used for continuous drainage. Preparation for catheterization. A catheter should be used only when absolutely necessary, and the catheterization procedure itself should be done only by a trained person under sterile conditions. Infection is a major risk of urinary catheterization. Gather all equipment. Catheter, 10 cc syringe, sterile water, cotton balls with betadine, lubricant, sterile gloves, flashlight or lamp, urine collection bag, velcro leg strap or anchoring tape and disposal bag. Explain the procedure to the patient. Provide for privacy and adequate lighting. Positioning. The positioning the female patient in the dorsal recommend position, which is the knees flexed with the feet about 2 feet apart. Cover the upper body and each leg. Place the catheter set between the female patient's legs. Position a male patient in a supine position. Drape the patient so that only the area around the penis is exposed. Place the catheter set next to the legs of the male patient. Inserting the Foley catheter in a male patient. Cleanse the genital area and perineal areas with warm soap water and water. Rinse and dry. Wash your hands carefully. Open the sterile catheter kit using sterile technique. Put on the sterile gloves. Open the sterile drape and place on the patient's thighs. Place fenestrated drape with the opening of the penis. Applying the sterile lubricant liberally to the catheter tip. Lubricate at least 6 inches of the catheter. Leave the lubricated catheter on the sterile field. Pour the antiseptic solution over the cotton balls. Place a urine specimen collection container within easy reach. Grasp the patient's penis between your thumb and forefinger of your non-dominant hand. Retract the foreskin of an uncircumcised male. The gloved hand has been touched to the patient is now contaminated. Use the forceps to hold the cotton balls. This will maintain the sterility of one hand. Using the forceps, pick up the cotton ball and swap the center of the meatus outward in the circular manner. Continue outward using a new cotton ball of the each progressively large circle. Clean the entire glands. Deposit each cotton ball in the disposal bag. After the last cotton ball is used, drop the forceps into disposal bag as well. Hold the penis at a 90-degree angle. Advance the catheter in the patient urinary meatus. You may encounter resistance at the prostatic sphincter. Pause and allow the sphincter to relax. Lower the penis and continue to advance the catheter. When the catheter has passed through the prostatic sphincter in the bladder, urine will start to flow. Gently insert until 1 to 2 inches beyond where urine is noted. Inflate balloon using correct amount of sterile liquid. Gently pull catheter until inflation balloon is snug against bladder neck. Connect catheter to drainage. Anchor the catheter tubing to the lateral abdomen with tape without tension on tubing. Place drainage bag below the bladder. Evaluate this catheter function and amount of color, odor and quality of urine. Remove the glass and dispose of equipment appropriately. Wash hands. Document the size of catheter inserted, amount of water in balloon, patient response to procedure, assessment of urine. Inserting the Foley catheter in a male patient. Follow the procedure same with male from step A to H. Place the thumb and forefinger of your dominant hand within the labia minora. Spread the separate upward. The gloved hand has been touched. The patient is now contaminated. Using the forceps, pick up a cotton ball saturated with the antiseptic solution. Use one cotton ball for each stroke. Swab from above the meatus downward towards the rectum. Keep the labia separated. Cleanse each side of the meatus in the same downward manner. Do not go back over any previously cleansed area. Deposit each cotton ball in the disposal bag. After the last cotton ball is used, deposit the forceps into the bag as well. Continue to hold the labium apart after cleansing. Insert a lubricated catheter into the female patient's urinary meatus. Angle the catheter upwards as it advanced. If the catheter will not advance, instruct the patient inhale and exhale slowly. This may relax the sphincter muscle. Do not force the catheter. When urine starts to flow, insert the catheter approximately 1 inch further. Place the cup under the stream of the flowing urine to obtain sterile specimen if required. Inhale balloon using correct amount of sterile liquid. Gently pull catheter until inflation balloon is snug against the bladder neck. Connect catheter to drainage system. Connect the drainage bag to the catheter. Ensure the catheter to the inner aspect of the female patient's thigh. Place drainage bag below level of the bladder. Elevate the catheter function and amount, color, order and quality of urine. Remove gloves and dispose of equipment appropriately. Wash hands. Document size of the catheter inserted, amount of water in balloon, patient's response to procedure and assessment of urine. Maintaining an indwelling catheter. Wash your hands before and after caring for the patient and wear gloves when handling an indwelling catheter. Clean the perineal area with soap and water twice daily and after each bowel movement, especially around the meatus. Use a separate area of the cloth for each stroke. Avoid use of lotions or powder in the perineal area. Arrange for the patients to take a shower or tub bath and when permitted. The collecting container may be hung over the side of the tap. The catheter should be claimed temporarily if the collecting container is higher than a bladder. Teach the patient to maintain the catheter. Self-care helps the patient develop a feeling of independence and promotes the cleanliness. If the patient is ambulatory, instruct him in use of the leg bag. Encourage the patient to intake 2500 cc to 3000 cc of fluid daily. Change the indwelling catheter as necessary or in accordance with the local policy. Removing an indwelling catheter. Assemble or supplies and equipment. Identify the patient and explain the procedure to him. Advise him that there will be a slight burning during removal of the catheter. Provide privacy and assist the female patient in the dorsal rectum position. The male should be in a supine position. Wash your hands and put an X-ray gloves. Empty the balloon by inserting the barrel of the syringe and withdrawing the amount of fluid used during inflation. Pinch and gently pull the catheter near the point where the exits from the meatus. Clean the perineum or penis with soap and water. Dry the area well. Inspect the catheter to be sure no remnants remained in the bladder. If the catheter is not totally intact, report this promptly and save the catheter for further inspection. Empty the drainage bag, measure the amount of urine and record on the intake and output sheet. Remove the gloves and wash your hands. Discard the disposable supplies and return reusable supplies and equipment to the appropriate area. Record that the catheter was removed, the time and the date by whom. Note the amount, color and clarity of the urine in the drainage bag. Also document all patients' teaching done at the patient level of understanding. After removal of catheter, assess the patient for 24 hours for patterns of urinary elimination. Note the time and amount of first void urine. Report any of the following: inability to void within 8 to 10 hours, frequency burning and rippling and hesitation in the starting the steam of urine, cloudness of or any other unusual color of characteristic of the urine. Provide a level of fluid similar to the intake when the catheter was in place. Record that the catheter was removed, the date and time and by whom.